I can't say enough about the fact that when we started working on this, I dreaded calls to a governmental agency with questions. I just thought, I'll be on hold, I won't know which prompts, and I'll not talk to a human being, etc. It's been totally 180 degrees from that. Anytime I've called, I have been able to get to someone fairly quickly, and each and every person has been professional, knowledgeable, and pleasant. And I have not had one encounter on any of my calls that has been a negative. And I've been totally surprised about that. I was surprised at how easy the registration was. I dreaded that, and I thought this will take me forever. But the pamphlet that was given that we got online was excellent. It's very well done. I had a slight issue with was getting the number of our certification number for our software company. And of course, once I called the software company, they have all that documented. The governmental agencies have been easy to understand and accessible. We wouldn't have a fighting chance, but because of those two things, I do feel we'll be able to qualify. We're in the middle of the reporting period right now, October, November, December. And so far, with our software, we're 100%. Patients aren't that aware that we're doing this because it doesn't interfere with the doctor-patient relationship or the office visit. We're making sure, that we're getting all the medications in the EHR. And of course, they bring their list in of the ones prescribed by other physicians. These are things that maybe they didn't have to do up to a point, but it's much more inclusive, and we are doing the e-prescribing. I would just advise anybody to just go to your website, and there are a lot of links to go to, and you cannot go to all of them, but go to as many as you can, and slowly but surely it will start to fall in place. One thing, doctors' notes are known for being a little illegible, so EHR is good, and the continuity between office visits is much better because it's all in one patient section rather than paper after paper after paper, lab test results, part of the paper chart. And it is a definite transition, but I think it's worth it. It's not the answer to everything, but I do think it's good to have to move to EHR.